Look, I welcome the opportunity to contribute to this debate tonight. And just starting off, Deputy Breeden commented there about the doom and gloom merchants on the opposite side of the House. And I'm wondering, does he include Mr. O'Brien, the Chief Executive of the HSE, amongst those doom and gloom merchants, when he stated that the funding for the HSE is not in the best interest of patients, the cuts that are allocated for this year. Chairman, I would like to just give two short examples in relation to the impact that the cuts in funding on the HSE and the way the HSE has been run is having on my community in Donegal. And it ties in with the example that was given by Deputy McLaughlin of the difficulties in Letterkenny General Hospital. But Chairman, in Killybegs Community Hospital has 48 beds, is designated with 48 beds for respite care, long stay care for elderly patients that require it. But today, 8 of those beds are closed in Killybegs Community Hospital. They're closed for no other reason than because of the embargo in operation within the health services being operated by this government. Those 8 beds are closed because staff have retired, staff are on sick leave, and they won't be replaced by management to allow this hospital to operate at its full capacity. That means that many elderly patients are scattered around County Donegal, many of them 40, 50 miles away from their homes in nursing home care because they cannot access a bed in their own communities. And that's the impact that the cuts have had over the last number of years in the health services. And those cuts are continuing because there's no sign of that embargo being lifted. If we really want to see health services working for the benefit of communities, we need to ensure that beds in community hospitals are kept open and kept functioning, and that staff should be allocated on a temporary basis to make sure that that happens. And that feeds into the difficulties that Letterkenny General Hospital is having because patients cannot move out of the General Hospital into community hospitals because many, many beds are closed because of staffing shortages and because of the embargo that's in operation. And that is the crisis that we have in our community hospital sector across the country. Also, in the last week, the community on Arranmore Island were faced with the loss of a public health nurse. This is a community that's isolated, a community of 500 people, where 10 years ago there was over 1,000 people living on the island. And because of the withdrawal of services and the difficulties that's happening in this recession, people have moved away and emigrated. But this community had a vital link and a vital health service in having a public health nurse there available full-time on the island. And the HSE, in their wisdom, proposed to move this nurse from the island and replace her with a part-time nurse. Thankfully, the community mobilised and they got very active, and that decision was reversed today. And I welcome the fact that that decision was reversed. But the fact is that the community should never have had to do this. The community should have had to be comfortable in the knowledge that on all the threats that they face, the threat of the removal of health services from them shouldn't have been one. They should have been able to look to rebuild the population on their island, confident that services will be there for people. And like I say, that decision has been reversed, but only because that community mobilised and fought for the service that was there and a service that they're entitled to. I think those two examples give an idea of the crisis that many people face on the day-to-day across the country because of the lack of investment in our health services. And Mr. O'Brien, in launching the service plan, stated that his overriding priority in the service plan was patient safety, and his next priority is treating patients in as timely a fashion as possible, given the constraints the service is under. I think that's a sad indictment in 2014 of a health service, that the best we can hope for is that we can treat patients safely and then treat patients in a timely fashion. We should be looking to invest in our health services. We should be looking to develop our health services so that they can provide for our population and provide for the people who need that in the most way. And you look at the service plan, you look at the stuff that has been dropped out of it. 53 million euros dropped from services for older people. This is in a situation where in the next 10 years the population of over 65s in this country will double, and we will need, in community hospitals like Killybegs Community Hospital, we will need a doubling of the beds, not a cut in beds, not beds being closed because of an embargo. We need an investment programme to ensure that there's a double the amount of beds available in the next 10 years for that ageing population. We see that 3.9 million euros to extend the colorectal screening programme has been cut. That's an investment that would save money in the long run. And that's the short-sightedness of the HSE and this government and the service plan. We see €500,000 being cut from to to save money on breast check and prevent the further rollout of breast check. Again, it's an investment that would save money. The health services need investment and need increased funding, not this constant mantra of more for less, which is absolute rubbish.
Thank you.